So
Excuse me, everyone. Sex! Now that I have your attention,
You don't have our attention.
money!
I'm listening.
You had me at sex.
Pervert.
Okay, I love this show. So taking the pervert out of vascular access is what I like to say because of some history, and we're going to go over it. And this is why I think the ultrasound should be the standard and not the exception. Okay, what do I mean by pervert? Do I mean that you're a sexual deviant if you don't use the ultrasound? Of course not. However, for me, I think the negative implications are similar. Let me talk to you about that. Immediate auscultation. Does anybody remember this? I hope not. So I know some of us are still doing it because we left the stethoscope at home, okay? But this was revolutionary in the 1800s. Do you understand? I don't have to cut you up to know what's going on inside of the body. They saw patterns in the sounds, and so they listened to you to figure out what was going on. By the way you sounded, we could tell if you have pneumonia or if you're wheezing from asthma. And so the treatments were different. It was revolutionary.
I have a little congestion in my upper chest. Can you take a look at it?
I don't have my stethoscope, so why don't you just breathe in and out for me? Cough again. Once more.
It got weird. Okay? Quickly. So there was a lot of quacks. There was a lot of physicians who were groping their patients, and it got really uncomfortable. There was a lot of non-compliance. No, I don't want to see the doctor. So René Laennec, I think he's saying this. Anyone who's French, please forgive me. He invented the stethoscope. This was revolutionary. But I bet he was told, what are you talking about? If my ears are closer to the source of sound, isn't that supposed to sound louder? Aren't I able to perceive sound better if I'm closer to the source? Why would I want to be far away? That's silly. I'm sure there was a lot of resistance there. Isn't this a vascular access seminar? Why are we talking pulmonary? We have adopted the stethoscope at scale. Now it's weird if you walk into a room and your nurse or your doctor's like listening for the lung sounds. It's weird. We took this pervy practice and we adopted the stethoscope. We started our IV journey, I think as far back as 1500s was when we were recorded poking people for intravenous whatever. And we still insist on it. When I talk about vascular access to some nurses, they say, oh, I don't need the ultrasound. This is my ultrasound. I've been using this for 30 years. Why do I need the ultrasound? We insist on not changing, and I think that needs to change. Of course, it's metaphorically speaking. Do I think you're a sexual deviant? No, but there's negativity to it, and I think we need to improve that for our patients.